Hi, good evening, everyone. We are back again with an awareness session on Alzheimer's by HCH. Yesterday was World Alzheimer's Day, and that's why we thought, why not to take up this topic? और ये Alzheimer's है कि Alzheimer's है कि memory loss है, ऐसे बहुत सारी भ्रांतियां और बहुत सारे myths को bust करने के लिए we have a star-studded panel for you. So I'll share a story that one of my very close relatives suffered from memory loss. Initially हर किसी ने यही सोचा, अरे इनकी तो एज हो रही है, अरे ये तो भूल जाते हैं. Problem started when this person would say, तुमने मुझे नाश्ता ही नहीं दिया. मैंने कब नाश्ता खाया? अरे मैंने तो दवाई खा ली थी. To when that person became totally bedridden, and the family का सबसे बड़ा fear ये था कि इनको अकेला कैसे छोड़े. अगर इनको अकेला छोड़ा और ये कहीं चले गए और इनको याद ही नहीं रहा वापस कहां से आना है, then what will you do? And those various movies which show कि एक बूढ़े आदमी थे, वो बाहर चले गए और इतने साल बाद मिले, and all these news things, this creates a lot of worry, a lot of confusion, and a lot of uncertainty on maybe a solvable problem of memory loss. And that's where this awareness session has its role. So let me introduce my star-studded panel now. From Hyderabad, I have Dr. B.S.V. Raju. He's a senior consultant, Department of Neuro and Spine Surgery, Yashoda Hospital, Hyderabad. Did his MBBS from Ranganayaran Medical College, then did his MS Ortho, DNB Ortho, and then did his MCH from prestigious Nizam Institute of Medical Sciences into neurosurgery. Wow, that's great, right? He's member of Neurological Society of India, North American Spine Society, Indian Society of Pediatric Neurosurgery, Indian Medical Association, and again has numerous awards, achievements, and publications to his credit. I welcome you, Dr. Raju.
Thank you, sir. Thank you.
Well, we have Dr. Prem with us now from the western part of the country, Mumbai. Dr. Prem is a renowned geriatrician, which is a very rare species these days. But I'm hoping that with the elderly population doubling, we'll have more of these super specialists, I would say. He works with Jaslok Hospital and Research Center in Mumbai, and he has done his MD Geriatric Medicine from Amrita Institute of Medical Sciences. His areas of interest are geriatric medicine, comprehensive geriatric assessment, multimorbidity management, dementia and cognitive assessment, research and clinical updates, which is really good at. I welcome you, Dr. Prem.
Thank you. Thank you. Great to be back. Thank you.
And if I start reading his membership, he's member of more than 10 national and international associations. Hi, Dr. Ghosh. Dr. Ghosh is from Kolkata, again, the eastern part of the country. He's consultant cognitive and behavior neurology at Fortis Anandpur, Kolkata, with more than 14 plus years of experience. He's an MD gold medalist, DM neurology gold medalist, and owns a fellowship in cognitive and behavioral neurology from the prestigious University of Toronto, Canada. Impressive, Dr. Ghosh, and we are very, very happy to have you on this panel. I also have with me Shweta Sharma, who leads the vertical of geriatric care, assisted living, and memory care for HCH India. Welcome, Shweta. Welcome back on our show.
Thank you. Thank you, Dr. Gaurav.
So we'll start with Dr. Prem. So Dr. Prem, as I said, बहुत बार मैं भी बोलता हूँ, यार मेरे को लग रहा है मेरी यादाश्त कम हो रही है, right? Many a times, many a things I either try to type on my phone or try to scribble down with this fear that I will not remember. So what I want to throw light on is what is memory loss and how people use these terms, dementia, memory loss, senility, and now Alzheimer's in different parallences. क्या ये सब कुछ एक है या बहुत different चीजें हैं? Please share your views on that.
Yeah, so I think it's very important for us to know, हमें जानना बहुत important है कि याददाश्त जो हम हमेशा ऊपर रखते हैं, अगर हम अल्जाइमर्स की भी बात करें, पर सिर्फ याददाश्त नहीं जाती अल्जाइमर्स में. So although we keep saying that कि memory loss is the one. I would say it's the one which is most talked about or most marketed or most फ्राइटनिंग थिंग, जिसके वजह से आदमी को समझ में आता है कि नहीं, फॉर एग्जाम्पल मेमोरी लॉसेस। नाउ मेमोरी लॉस तो फॉर एग्जाम्पल कीज अगर हम भी रख जाते हैं, आई मीन एट एनी एज यू कैन फॉरगेट योर कीज, बट इट कम्स बैक टू यू। सो आई थिंक द मोस्ट इंपॉर्टेंट थिंग इज कि अगर आप कुछ चीज भूलते हैं तो वो वापस आती है, तो उसको दैट यू कैन नॉट कॉल इट डिजीज, दैट कैन हैपन इन अ वेरी नॉर्मल पर्सन। तो अगर नॉर्मल एजिंग भी होता है तो उसमें भी लोग भूलते हैं, बट द डिफरेंस बिटवीन अ पर्सन हु माइट हैव अ टाइप ऑफ अ डिमेंशिया, डिमेंशिया टर्म ही एक्चुअली बाद में यूज होता है, कोग्निटिव इम्पेयरमेंट हम बोलते हैं, जिसका मतलब है कि ब्रेन थोड़ा इम्पेयर्ड है, उसमें मेमोरी वन ऑफ द फैक्टर शायद इम्पेयर्ड है। पर डिमेंशिया में क्या होता है, उनको रियलाइज भी नहीं होगा कि वो भूल रहे, तो वापस सोचने की बात तो अलग है। फिर एक बात है कि अगर अगर रूट्स तो हम भी भूल सकते हैं, एक लेफ्ट टर्न मिस हो गया पर हमें रियलाइज हो जाता है कि नहीं, पर अगर एक पर्सन जिनको डिमेंशिया है उनको उनको समझ में ही नहीं आएगा। इनफैक्ट नए जगहों में अनफेमिलियर एरियाज में तो वो इतने कंफ्यूज हो जाते हैं और इरिटेट हो जाते हैं, क्योंकि दे फील वेरी सॉर्ट ऑफ डिफिकल्ट टू इवन अंडरस्टैंड द सराउंडिंग्स। तो ओरिएंटेशन की बात भी खराब हो जाती है। आई एम जस्ट ट्राइंग टू से कि क्या क्या डिफरेंट चीजें खराब हो सकती है। वेरएस एक और चीज है कि हम पहले से हमेशा लिखते थे, तो बहुत सारे टाइम लिख के याद रखते थे चीजें, चाहे स्कूल में हो, मेमोरी जो है हमारी वो कंसोलिडेट करते थे। पर एक पर्सन विथ डिमेंशिया होगा, उनको लिखने में वो कोहेरेंटली, मतलब चीजें लिखने में भी और उसको एक्सप्रेस करने में भी बहुत ज्यादा डिफिकल्ट होगी। इनफैक्ट बहुत एक्सटेंड तक स्पीच भी अफेक्टेड होगा। कभी कभी बहुत सारे टाइम क्या होता है कि नॉर्मली भी बात करते हैं तो रिलेटिव बोलते हैं बस आपके सामने तो बहुत अच्छे से बात कर रहे हैं, पर घर पे तो भूलते रहते हैं, कुछ भी नहीं आता है, मतलब समझ में नहीं आता है, इनको बार बार पूछते रहते हैं कि मुझे भूख लग रही है, खाना नहीं दिया, पर आपके सामने तो ठीक है। सो व्हाट हैपेंस इज दैट कि इट्स जस्ट दैट रिपीटेबिलिटी होती है, और उस टाइम पे सर्टेन चीजें हैं, शायद डोमेन्स वो प्रिजर्व रहते हैं। इसीलिए आगे चल के ऑफ कोर्स हम बात भी करेंगे कि कैसे नॉन फार्माकोलॉजिकल देख सकते हैं, तो वहां पे ही बात आती है कि हर चीज में कुछ किया जा सकता है। फिर सिनाइलिटी जो हम बोलते हैं, दैट वर्ड इससेल्फ में बहुत नेगेटिविटी है। अगर हम हिंदी में बात करेंगे तो फिर और भी नेगेटिव हो जाता है, बूढ़ा हो गया है, बुढ़ापा है, आई मीन दीज आर ऑल वेरी नेगेटिव टर्म्स। तो इसीलिए डब्ल्यूएचओ और वर्ल्ड ने भी देखा गया तो दे हैव चेंज द टर्म नाउ, वी ओनली से ओल्डर अडल्ट्स, वी डोंट इवन से दैट कि सीनियर सिटीजन है या जीरियाट्रिक एज ग्रुप है, वी से ओल्डर अडल्ट्स। तो वो नेगेटिव कॉनोटेशन होता है, पर उसका मतलब नहीं है, सी ओल्ड एवरीबडी इज हैपनिंग, व्हाई इफ आई एम, इफ वन पर्सन इज बॉर्न, एक फर्स्ट ईयर का बर्थडे में तो 1 ईयर ओल्ड हो ना, तो यू आर गेटिंग ओल्डर एवरी ईयर। सो यू कैन नॉट से कि जस्ट बिकॉज आप ओल्ड हो रहे हो तो आपको डिमेंशिया पक्का होगा। देन व्हाट वी हैव टू इवन अंडरस्टैंड इज कि हमेशा याद ये रखना चाहिए कि हम हमेशा मन में ये रखते हैं कि पर्सन विद डिमेंशिया का मन नहीं बैठ सकता, ऐसा नहीं है। पर्सन विद डिमेंशिया कभी कभी उनको डिप्रेशन भी होता है। अगर वैसा हो तो मतलब पूछ, हमें समझना भी इतना मुश्किल होता है। आई एम श्योर द अदर पैनलिस्ट विल आल्सो एग्री कि इट बिकम्स वेरी डिफिकल्ट टू डायग्नोस। तो एज अ केयर गिवर आपको याद रखना है कि थोड़े ऑब्जर्वेंट रहना पड़ सकता है, स्पेशली चेंजेस हो रहे हैं धीरे धीरे, वो एजुकेशन से ही होगा। और दूसरी बात है, क्योंकि पर्सन विद डिमेंशिया माइट नॉट इवन नो दे आर सफरिंग फ्रॉम इट, मतलब उनको, मुझे तो याद रहता है तुम कुछ भी बोलते हो, इनफैक्ट दे विल गेट इरिटेटेड सेइंग कि तुम क्या कर रहे हो। बट मैं इतना कहूंगा, प्लीज डोंट ओवरलैप एवरीथिंग। जस्ट बिकॉज मेमोरी लॉस है उसका मतलब ये नहीं है कि आपको पक्का डिमेंशिया होगा, पर उसका मतलब ये नहीं कि वो रूल आउट हो गया है। और जस्ट बिकॉज यू आर गेटिंग ओल्ड डजंट मीन you will definitely get dementia or you will definitely get Alzheimer's. No, that is not the way it is. Ultimately there are certain things which can happen, which we will sort of take up later, but प्लीज अंडरस्टैंड कि सब कुछ डिफरेंट है। प्रॉब्लम होती है, कंफ्यूजन हम क्रिएट करते हैं जब सब हम इंटरमिक्स कर देते हैं, एंड दैट कैन बी अ प्रॉब्लम।
So, what's the difference between dementia and Alzheimer's, Dr. Prem?
Yeah, so I think one of the very important things is Alzheimer's is a type of dementia, whereas you cannot interchange them. Whereas dementia is an umbrella term. उसके ऊपर वो बोलते हैं ना, एक बड़ा सा अम्ब्रेला टर्म है जिसके अंदर वेरियस टाइप्स ऑफ डिमेंशियाज आते हैं, अल्जाइमर्स इज जस्ट वन टाइप, उसमें बहुत सारे टाइप्स हैं, पार्किंसन के साथ भी होता है, फिर बहुत सारे रिवर्सिबल कॉजेज भी हैं जिसको बदला जा सकता है। तो एक चीज और समझिए, डोंट सी कि वो जो डी होता है, इसलिए मैंने बोला ना, हम हमेशा कोग्निटिव इंपेयरमेंट बोलते हैं हमारे इनिशियल डायग्नोसिस में, क्योंकि वो डिमेंशिया वाला आ जाता है तो फिर इट्स जस्ट अ सॉर्ट ऑफ अ रेड थिंग फॉर पीपल, ओ माय गॉड डिमेंशिया हो गया, अभी लोग क्या कहेंगे, for a relative it becomes, and for the patient themselves it becomes a bit, yeah. And if you see, I mean, if you remember, whenever, even in movies, when people say demented, it's always said in such negative connotations कि उनको लगता है कि oh my god कि मतलब क्या हो रहा है. So that's the bottom line. Please understand कि don't interchange. Alzheimer's is a type of dementia. That doesn't mean that, and it is the most common type, but that doesn't mean it is the only dementia.
And dementia is not doomed. That's your message.
Yeah, absolutely. At every stage, something can be done. So don't feel things cannot be done.
So Dr. Raju, as Dr. Prem said, that dementia is a umbrella term, and the biggest cause of dementia is Alzheimer's. But there are various causes, there are various treatable factors, right? And there are risk factors. So what I want you to share with our viewers is that what are those risk factors, what causes Alzheimer's, and what are the treatable causes which can be easily be treatable and patient will not have to live with dementia or Alzheimer's?
Yeah, I think that's a very important question, Dr. Gaurav. Let us start with the treatable causes of dementia. Many times, all patients may not exactly give a history that let's suppose somebody has a brain tumor. It's classical to have it present with a headache or some kind of a weakness or other thing. But with a well-known entity of a subset of population, especially they have been located in a frontal lobe or a temporal lobe, they present only selectively with a behavioral disturbance or a memory loss. This is a very well-known entity. So I think we need to dig into the history a bit more. I think that will uncover whether there are any associated factors or anything. Similarly, even a dementic person can have a minor fall which they don't try to remember. So it's like a chronic subdural hematoma. It's a gradual accumulation of a bleed in the brain, which is a completely curable cause, or it has a good results in more than 90-95% of the patients. It can be overlooked. We see these patients in my journey of over 30 years. I think we have seen it time and again, those things, and it's not like because they're not very common, they tend to be missed out. And the most important subset of the population is a subset called as a normal pressure hydrocephalus. In this thing, the classical triad, they basically present with a gait issues, sometimes with later with incontinent issues, and later the cognitive issues. But incontinence and cognition are sometimes intermixed. It is very difficult. But somebody presents with the classical gait issues, I think you can tend to pick it up. But otherwise, they may come with a mixed bag of pictures. There again comes the clinical acumen of trying to make sure that you're not missing out something. So the thumb rule there is like, basically don't tend to think everything has been like a same diagnosis as a broad diagnosis of a dementia. Let's try to evaluate clinically, understand what could be the cause, and should be evaluated ideally by a neurologist, because most of the times these patients tend to come to the neurologist only, so or a geriatrist. So I think these are three conditions, like like any kind of a tumor or a mass lesion, be it like a chronic subdural hematoma or a tumor, and a normal pressure hydrocephalus, which has a reasonably good prognosis, wherein once you try to identify, once you patient, they have a reasonable good quality of life for several years. And ultimately, I think you can reverse it. The medical causes are very many, like, you can have deficiencies of any of the vitamin B12 or metabolic issues like hypothyroid or anything, even a metabolic issues like even hypoglycemia, repeated headache. These are all things that can cause it. That what I mean to tell is basically you should try to get it evaluated rightly by a specialist, so that they try to screen you and make sure that they run the routine tests what is being required, ideally in an MRI or a scan, so that they can be handled, and they have a huge day of hope for this kind of. So the other question what you asked is, and what is the other question?
I asked any risk factors which lead to Alzheimer's.
Yeah, Alzheimer's is basically an extension of a genetic, environmental, and lifestyle disorders. So I think the common thing in India, we have become in the diabetic capital of the world. I think diabetes, hypertension, any of the cardiovascular or vascular diseases are very, very common, increasingly common because of the lifestyle diseases. And obviously, the most important thing is any of your family members or they have a genetic predisposition. And the lifestyle, it is very well known that people who are sedentary or isolated, they tend to have a higher risk of having this. And the thing is, like, staying active is the best form of life. I think if whoever does not stay active, I think they can have all these risk factors and this thing.
Thank you, Dr. Raju. I'll go to now the neurologist in the house. As you mentioned, these patients go first to the neurologist. And Dr. Shinjin Ghosh, would you like to add on to my question of what is Alzheimer's disease and what causes it?
Thank you very much, Dr. Chokral, and beautifully explained by Dr. Prem and Dr. Raju. So in terms of the Alzheimer's disease, it's named after Dr. Aloy Alzheimer's. So it's one of the most, as Dr. Prem was mentioning, that it is one of the most common subtypes of dementia that we see. And they're usually present with memory issues. And they also have a problem with navigation and what we term it as visuospatial dysfunction. That as you started with the story, right? They leave their homes and they are unable to come back. What's striking is that even familiar surroundings become so strange for them. They're unable to figure out as to which way to take to come back home. So these kind of issues when they start appearing. So what is very important is to go to a physician and to get a test battery done. What we have different test batteries where we can actually diagnose objectively whether the individual is having some cognitive impairments. So many a times we see some people do have anxiety issues, depression, and other psychiatric conditions like bipolar disorder, which can present with some cognitive impairments, such as problems with memory, attention, mood changes. So in those cases, with the cognitive testing, detailed cognitive testing, we can tease out whether this is something, whether we are dealing with a neurodegenerative condition, such as Alzheimer's, where it is usually a progressive disorder. The pace of the progression varies from person to person, but sometimes it's a progressive disorder. And sometimes if somebody has a depression or anxiety, once that is treated, things are better. And it usually has a static course or things improve. So those are the most important parts of diagnosing Alzheimer's. So what happens in Alzheimer's? It sometimes can be familial. It can have a genetic basis. It might run in the family, but it doesn't mean that if somebody has parents who have Alzheimer's will get the disease, right? So there are genetic mutations, but there are additional risk factors as well, which can contribute to the memory issues and cognitive impairment, such as low social interaction and even the educational background is also important. Like that makes the brain more resilient. Learning different languages, what is seen, and there are studies on bilingualism. People who know 2 or more languages are protected against all these neurodegenerative conditions and dementia. And what happens is that there's an abnormal protein accumulation on the brain, and that triggers the process of cerebral atrophy or brain shrinkage. And then different parts of the brain have different functions. So if that part is atrophied, and then we start seeing those manifestations. And that's how we then do some test batteries, and then we come to a diagnosis. Then we have some biomarkers, such as, what is a biomarker? Basically, it is an indicator that helps in your clinical diagnosis, right? Clinically, we think, okay, these are the points in favor of Alzheimer's. But when we get an MRI done and we see the brain shrinkage in different areas, or like Dr. Raju was mentioning, we sometimes find that, okay, it's a treatable condition, right? The person has normal pressure hydrocephalus. So we can do something about it. And as Dr. Prem was mentioning, that in younger individuals, sometimes they do have cognitive issues. They start thinking, and the family, they are worried whether they are having young onset Alzheimer's or not. Many a times we do see autoimmune encephalopathies and infective encephalopathies, which are treatable conditions if diagnosed at a very early stage, and they absolutely respond to treatment. Right, and so there are other management as well, but
Thank you. We'll come to the management, Dr. Ghosh.
Yeah.
That was very, very lucid, and I thank God that I'm trilingual. I know 3 languages. That was a news to me. That protects me against neurodegeneration. And I'll go back to Dr. Prem. And Dr. Prem, here I have a very interesting question for you. It's a chronic disease. It is found when it is at an advanced stage, and all chronic diseases, we push for early detection, right? We have so many health checkups sold by many labs, many hospitals, advised by doctors. Full body checkup करा लो तो आपको chronic metabolic diseases का पता चल जाएगा. Is there a way that we can screen Alzheimer's or dementia at a very early stage? Are there any tools available for that which people might not be aware, and we can make them aware through this session?
Yeah, definitely. I mean, just to add on to a couple of risk factors, as a geriatrician, there are 3 things that matter to me a lot. One is vision, second is hearing, and third is the teeth. Now, it's very well sort of proven by research that hearing loss, अगर सुनाई नहीं देता है तो वो काफी बड़ा risk factor है dementia के लिए भी, and to a great extent even Alzheimer's के लिए. Then I think sleep is very important, because sleep there have been a lot of studies. In fact, there's a condition known as obstructive sleep apnea, जिसमें बीच में सांस भी रुक जाती है लोगों की रात को, और फिर of course sleep study वो सब टेस्टिंग करनी पड़ती है, तभी समझ में आता है. So again, that is something which is a risk factor but can be treated or can be corrected. Then two behaviors which can be quite harmful. One is smoking and drinking. So even these two are sort of quite, you can say, add on to the risk factors. And as already Dr. Raju mentioned, I just wanted to, it's said that sitting is the new smoking. So if you're sedentary, then you are harming not only your body, but your brain as well. And okay, coming back to your question, I think if we see in general, we always see hospitals, we see maybe a senior citizen health package, we see a renal package, we see a cardiac package, but we don't generally see a brain package always. It's not necessarily seen, but it is something which usually might be covered if somebody actually expresses the concern, and a lot of times maybe not looked for. Now, health checkups are very good. First, I'll just comment on that. It helps us in tackling the risk factors. Sugar hai, then blood pressure agar detect ho gaya, cholesterol hai, and the reversible causes, vitamin B12, folic acid, and thyroid. These all usually, I mean, in an elder health checkup, we usually anyways do it because usse ye ho jata hai. But pertaining to specifically to the brain health. Now, people always have this fear कि नहीं brain के बारे में कुछ भी बोलेंगे तो direct हम imaging ही बोल देंगे, and that is not the case. ऐसा नहीं होता है. We actually test people out. So as Dr. Ghosh already mentioned about that, there are certain cognitive tests which we do. Now it's very simple. There is something known as a mini cog, which is a test जिसमें क्या करते हैं हम, we just tell them कि आप 3 शब्द बताइए, याद कीजिए और उसके बाद उसको repeat कीजिए. Then we just tell them to draw a clock. And then we also tell them to recall the 3 words. It's a very short test. उसमें ज़्यादा time नहीं लगता है. And then we at least get an indication. Now, one thing about testing is there is also something known as an MMSE, which is a mini mental status examination. There is a MOCA. There is also something known as Edinburgh's cognitive testing, which is known as ACE. So cognitive exams. However, as a clinician, it's important that we decide which test to do on which setting, because sometimes अगर आप स्क्रीन कर रहे हैं तो मिनी कॉग इज इनफ. अगर आपको और ज्यादा करना है कुछ तो फिर मे बी यू विल हैव टू सी अदर टेस्ट लाइक मे बी एन MMSE. नाउ व्हाट इज इंपॉर्टेंट फ्रॉम अ पेशेंट्स पर्सपेक्टिव इज कि just when you go for a normal health checkup, a memory testing is good. Now, what I am seeing in general is in a lot of places, at least memory testing has now come as compared to earlier. Maybe before the pandemic also उतना नहीं होता था जितना अभी हो रहा है, and people are going to these memory camps. So I think the onus is also on us as geriatricians and neurologists to do more and more memory camps wherein people can come and at least test their memory in the very simple testing which we can choose, whatever is appropriate for that setting. And please don't fear. Worst come worst, what will happen is we will detect that you have some memory loss. Again, let me reiterate, हर memory loss Alzheimer's नहीं होता है, हर memory loss dementia नहीं होता है. तो अगर कुछ reversible हमें मिल जाएगा तो we will help you to treat. If we don't detect anything, we know you're aging well. You'll be happy about it. So there is nothing to lose. So this testing is usually done, और उसके बाद अगर लगेगा तो then we go on to blood investigations and maybe even imaging, which is obviously comes later. So don't worry about showing yourself, because होता क्या है, when you don't try to approach your health personnel only, then you might be losing out on those risks or those red flag signs which you are having maybe. But आप होता क्या है, there is a distinct denial from the patient's part and relative, as जैसे मैंने प्रीवियस क्वेश्चन आपका था, मे बी इट्स अ पार्ट ऑफ एजिंग, थोड़ा एज बढ़ रहा है, लोग तो भूलते ही हैं. let's not make this population of older adults and people with Alzheimer's a homogeneous population. They are not. Everybody is different, and every older adult is different. So we need to make sure कि आप routine testing में कीजिए and be free to ask questions to your doctor. I'm sure they will be ready to answer, so that we give you better sort of knowledge and you get yourself tested. So please get yourself tested, whether you have problems or not. Maximum kya hoga, we won't detect anything, and that is good.
Great, and I really can feel your pain for your patients. You really don't want them to be overstressed with memory loss and these things, and the way you are destigmatizing the whole issue, I really appreciate that. Let me go back to Dr. Ghosh on the medical treatments of Alzheimer's before I go back to Dr. Raju on the surgical treatments of Alzheimer's. So, Dr. Ghosh, what is the treatment of Alzheimer's?
Very pertinent here. So, because the first thing when people have a diagnosis of Alzheimer's is that, do we have a treatment? And the next question is whether my son or daughter can have this disease. These are the two most important questions we face in our clinics. So in terms of treatment, there are two aspects. One is a condition is treatable or manageable with medications, and one is something is curable. So jar se utana hai, that's something that's cure, and treatable is we can slow down the progression, we can manage other symptoms, other behaviors, those kind of things. So the key factor about Alzheimer's or any dementia is to identify it's basically individualized. It depends upon the person based on their likings, how they were as a person premorbidly. Like now, what do we mean by premorbid condition, premorbid thing? That before they had any cognitive issues, what kind of personality they did have. Okay, so depending on that, we formulate a care plan. We have neuropsychologists and we have other social workers and occupational therapists. We prepare a non-pharmacological care plan where we tell the caregivers how to deal with the individual with dignity and respect. That's very important because people do have insight. Many of the dementia patients who have dementia, they do have some insight. And so treating with dignity is the utmost important thing, and also reassuring them that, okay, we are here for you. Because during the pandemic, what happened is many patients who did have cognitive issues, they had a rapid decline in their cognitive functions. So social interaction and interacting with friends, that's very important. Maintaining a routine, maintaining sticky notes, marking up calendars, those are important. And then coming to the pharmacological management, medical management, we do have some medications such as what we call as cholinesterase inhibitors that slows down the progression. And we do have another medication called memantine. So these we do prescribe to slow down the progression. And another exciting thing, what we are now seeing is that in USA, the US FDA has approved 2 anti-amyloid therapies. Just like I was mentioning, amyloid is an abnormal protein that is accumulated in our brain. So at a very early stage, it has been seen and proven in trials that those amyloid depositions can be broken down by these medications, right? So these are still quite expensive and needs more research and needs to be more affordable before we start using in our patients. But for that, what Dr. Prem was mentioning, early diagnosis is the key. That's very important. And then coming to the behavioral management, as I was mentioning, we have individualized care plans. I've been working in a behavioral care unit where we had individuals with moderate to severe behavioral issues like aggression as well. So many times we see that patients do have those manifestations, aggressive manifestations around care. When the caregivers try to change their clothes, they try to feed them, they have these problems. So if we we follow a routine and we take them to feed in a specific place, familiar surroundings with pictures of family members, broad daylight, a clock, a calendar, so that they are not disoriented. These are very important factors.
Thank you, Dr. Ghosh. That was really, really useful. At least you didn't say that it is not treatable and not curable, right? Because most of the people think that ab ho gaya, ab kuch nahi hoega. I'll go back to Dr. Raju now. Dr. Raju, what are the surgical, treatable, curable things which can be done to cure memory loss, Alzheimer's, and dementia?
Yeah, as I told you, there are a few things like a brain tumor, which can present as a dementia, any of the brain tumor or a mass lesion. Sometimes a chronic subdural hematoma, there is an accumulation of blood clot gradually over a period of time. And this is one thing almost like near always treatable. More than 95% of them, they do very well. And the other important part of a big subset of the population, which always needs to be kept in mind, is that hydrocephalus. We call this set of hydrocephalus as a normal pressure hydrocephalus. What is it? What does it mean? Means the pressure in the brain when you talk about hydrocephalus, hydrocephalus is accumulation of water in the brain, and it is under pressure. However, contrary to the normal hydrocephalus, here the kind of hydrocephalus what we see in elderly population is the pressure is normal, is dissipated over the pressure gradient between the within the fluid that's called as the ventricle and the brain. But still the gradient is there, the pressure is normal. So when the fluid is removed by a procedure called as a shunting, wherein we put a drain from the head to the stomach, wherein you try to remove the water, they tend to have a good improvement of their function, maybe cognition, memory, and all that. So these are a good set of population, they will do very well. And coming to the surgical aspects, what are the things we can do for Alzheimer's? The work for surgery is like there are several techniques that have been tried for surgically. Some of them have been included, but they are not does not have a statistical significance. There's still a work in progress. The few things which look have been done or otherwise is one is called as a CS of shunting. That is what I told you. The water in the brain is diverted by a pipe into the abdomen. So what does it mean? That means it tries to reduce the amount of pressure in the brain so that it will cause more amount of blood supply to the brain, and the amount of protein, abnormal protein, was what Dr. Sinjan Ghosh was trying to tell, is like they tend to find that the amount of load of the abnormal protein, which is interfering with the normal networking of the brain, is reduced. So they are found to be useful in few things, but at this point of time, the studies have been given up. Other thing is, we know that here what is happening now in Alzheimer's is we are short of the normal neuronal network the network is not functioning. Why is it not functioning? Because you have abnormal accumulation of a protein which prevents the normal firing of the nerves, and ultimately the power of the brain is the network. So that it is entire thing is, unless the network is fully functional, we cannot have the normal functions of memory, cognition, or any of the evolved function of decision making, judgment, and other things. So what is they're trying to do is we are trying to deliver a nerve growth factor intrathecally and see whether they are able to do well into the brain. So that means we're trying to stimulate, neural power or neurogenesis in this by delivering the extra neuronal factors. But this has been found to be useful. It has a strong basis, but still it's a work in process. And other important thing, possibly the one which holds the best promise, is the electrical stimulation of the brain. So now we know that the electrical modulation of the brain in the Alzheimer's is not good. That means you're not able to pass a signal in the brain to execute an act like speaking, thinking, memory. Memory is a multi-dimensional step. You have thinking about a memory. So what is the deep brain stimulation of the brain can does? It can modulate the entire networking, re-establish the network. Because of the stimulation, it causes neuronal generation, it causes newer pathways of establishing the network. So there have been several parts of the brain which have been stimulated and tested, and some of them have been found to be useful. And this is possibly the one of the ray of hope as for the patients. And I think down the road, in a decade or so, I think we'd like to hear more on particular things. There are other things, even like when you try to stimulate for a non other functions, like a vagal nerve stimulation is being done. You stimulate a nerve in the neck called as a vagus. So this nerve is stimulated basically to control fits. But however, these have been found that when you stimulate this vagus nerve, they found to have even the benefit of cognition and behavior. So there have been several patients have been there. I think there's a lot more things. I think we are not able to uncover the mystery of this particular this thing. And to my mind, I think the best ray of hope at this point of time is the electrical stimulation of the brain, which we called as deep brain stimulation. So I think and there may several other things have been in place. Just many of them are in double-blind randomized studies. But at this point of time, the best we can make them is it's a work in progress with a lot of promise, but not of conclusive evidence.
Thank you, Dr. Raju. I think from saying that there is no treatment, both Dr. Ghosh and you have given us a lot of hope that these people can treat and live a normal life. Before going to Shweta to understand her experience of living with dementia patients, I would ask Dr. Prem one question, that with so many treatable options, with so many experimental options going on, what is the progression of this disease? What are the various stages? And is there a way that we can halt the progression of this disease?
Yeah, so I mean, the biggest thing with Alzheimer's, depending upon the stage, of course, is कि हमें समझना चाहिए कि a lot of times there might not be a cure also, but there is always a chance of care. So we have to focus on the fact that care करना कभी भी बंद नहीं करना है. Cure हमेशा शायद नहीं कर पाए, पर care करना जरूरी है. And it is from a clinical perspective also, and from the perspective of maybe a caregiver as well. And of course, there are also non-pharmacological sort of therapies, which I just wanted to add. There is music therapy, there is art therapy. I mean, I have myself seen a person with Alzheimer's who has never done craft in their life create such beautiful craft, which people will be surprised at, but he or she has not done it before. But that's where, so what we say is the ideal thing is कि pharmacological के साथ साथ आप non pharmacological भी start कीजिए. Do not think कि नहीं पहले ये कर लेते हैं फिर उसके बाद वो करेंगे. That's not how the disease works. One has to make sure कि साथ में चीजें करें, वो full effort लगाएं तो बहुत ही अच्छा है. Another thing that helps us is that you never forget that it is not a bimari or not a disease. There is a person behind that disease also. Sometimes होता क्या है कि Alzheimer's में हम ये भूल जाते हैं कि वो जो person भी पीछे है, वो अभी भी है, उनका dignity उतना ही important है, उनका जो वो राइट टू गेट ट्रीटेड या राइट टू हैव अ गुड क्वालिटी ऑफ लाइफ उतना ही इंपॉर्टेंट है एज कंपेयर टू नॉर्मल पर्सन। नाउ स्टेजेस में अनफॉर्चुनेटली इट्स अ क्रोनिक न्यूरोडिजेनरेटिव डिजीज। तो होता क्या है, कभी कभी हम खुश हो जाते हैं, जैसे इवन डॉक्टर घोष विल अग्री की वो प्लेटू में चला जाता है, उसका मतलब कि कुछ नहीं हो रहा है, खराब भी नहीं हो रहा है, ठीक बहुत ज्यादा नहीं हो रहा है, बट ठीक है, इवन द फैमिली इज ओके एंड देन दे आर लाइक कि चलो अच्छा है, बट देन थिंग्स कैन गो हेवायर वेरी वेरी क्विकली एंड इट कैन बी सॉर्ट ऑफ रैपिडली प्रोग्रेसिव ऑल्सो। तो अगर हम स्टेजेस देखें तो यूजुअली क्या है कि एक प्री क्लिनिकल स्टेज होता है, तो उसमें क्या होता है कि थोड़े चेंजेस होते हैं दिमाग में बिफोर इवन द पर्सन एक्चुअली शोज द साइंस। तो ये बहुत ज्यादा टाइम के लिए रह सकता है, ईयर्स के लिए ऐसे जा सकता है कि प्री क्लिनिकल स्टेज में ही है, कुछ साइंस भी नहीं आ रहे, पता लगना बहुत मुश्किल होता है कि उसमें अल्जाइमर्स है भी उनको। फिर एक माइल्ड स्टेज होता है, उसमें क्या होगा, बस थोड़ी थोड़ी चीजें भूल रहे हैं, माइल्ड फॉरगेटफुलनेस। लोगों को अनफॉर्चुनेटली जैसे मैंने बोला है कि द फैक्ट दैट कि एजिंग के साथ ये माइल्ड फॉरगेटफुलनेस भी होता है, कभी कभी ये उसके साथ दब जाता है कि मतलब नहीं एजिंग है तो मे बी माइल्ड फॉरगेटफुलनेस। फॉर एग्जांपल क्या भूलते हैं, एक नाम भूल लिए या कुछ रीसेंट इवेंट भूल लिए, शादी थी अरे भूल गए। फिर आ, कुछ कुछ बहुत ही इंपॉर्टेंट पैसे कहाँ रख दिए वो याद नहीं आ रहे। फिर प्लान्स बनाना, हमें प्लान्स बनाना हमेशा लगता है कि बहुत इजी सा एक जॉब है, इतना आसान नहीं रहता है। इट टेक्स अ लॉट ऑफ प्लानिंग, इट टेक्स अ लॉट ऑफ ब्रेन को, ये कि इस टाइम पे ये करना है, ये आएगा, वो काम हमें करना है। तो अल्जाइमर्स में वो चले जाता है, तो माइल्ड डिजीज में थोड़ा सा ये जाना शुरू होता है। एंड देन वी ऑल्सो सी इन द माइल्ड डिजीज जैसे जैसे हम आगे जाते हैं, मे बी मैनेजिंग मनी, थोड़ा सा ऑर्गेनाइजेशन। फॉर एग्जाम्पल समबडी इज बीन वेरी ऑर्गेनाइज्ड इन देयर लाइफ बट थोड़ा सा ऑर्गेनाइजेशन खराब हो रहा है। फिर मेमोरी लैप्सेस फ्रेंड्स के साथ, फैमिली के साथ। फिर मॉडरेट टू मिडिल स्टेज जिसको हम कहते हैं, वो लॉन्गेस्ट स्टेज होता है, वो भी बहुत साल हो सकता है। उसमें क्या है, नई चीजें सीखना। रिमेंबर देर इज नो एज फॉर लर्निंग, यू कैन लर्न एट एनी एज, बट इन द मॉडरेट मिडिल स्टेज जो होता है उसमें लर्निंग डिफिकल्टी हो जाता है। फिर डिफिकल्टी इन रिमेम्बरिंग इवेंट शुरू हो जाता है, ट्रबल इन मतलब कॉम्प्लिकेटेड इवेंट्स अगर कुछ भी हो। फॉर एग्जाम्पल डिनर, डिनर करना या डिनर बनाना भी एक कॉम्प्लिकेटेड चीज हो जाती है। फॉर अ होम मेकर who's done everything for years together, everything is intact, dishes are intact in the brain, but it becomes very complicated. Then you are asking the name, it's trouble हो रहा है, मेरा नाम हाँ वो आ नहीं रहा है, वो नाम आ रहा है पर उनको they are not able to express details, very basic details about their life. फॉर एग्जाम्पल उनका फोन नंबर क्या है जो उनको हमेशा से पता था। देन प्रॉब्लम्स इन रीडिंग राइटिंग, एंड एज द डिजीज प्रोग्रेसेस फेमिलियर लोगों के नाम भूल जाना, स्पाउस का नाम, चाइल्ड का नाम। फिर ट्रैक, लूजिंग ट्रैक ऑफ मे बी टाइम एंड प्लेस। फिर नॉट चूजिंग द राइट क्लोथिंग, क्लोथिंग गलत हो जाना, मतलब बटन ऊपर नीचे कर दिए हैं। फिर रात को रेस्टलेस हो रहे हैं, थोड़े मूडी हो रहे हैं। सो दोस चेंजेस कैन हैपन इन मॉडरेट, सिवियर एंड लेट स्टेज में। See, this is where we are very worried. Why? Because quality of life starts getting affected very badly. वॉकिंग, सिटिंग, ईटिंग, वो वाले एबिलिटीज चले जाना। तो हम जीरियाट्रिक्स में एक चीज कहते हैं कि हम क्या क्या कर सकते हैं इंडिपेंडेंट रहने के लिए, तो ये सब बेसिक चीज है, वो करना हो जाता है। देन लूजिंग योर कंट्रोल ऑन योर स्टूल एज वेल एज यूरिन, दैट कैन हैपन इन सीवियर स्टेज। फिर थोड़े वर्ड्स ही बोलना, फ्रेजेस बोलना, no conversation, there is no meaningful conversation that the older person with maybe Alzheimer's can do. Help in all activities, forget basic activities जो करना है, इवन मोबिलिटी इधर से उधर लेके जाने में भी, and is unaware of anything. तो होता है क्या, लॉट ऑफ टाइम्स पीपल केयर गिवर्स कीप सेइंग नहीं उनको पहले का बहुत याद रहता है, बट दैट इज नॉट द साइन दैट एक्चुअली गोज। द साइन विच गोज इज रीसेंट मेमोरी चले जाना, विच कैन हैपन वेरी अर्ली। फिर unaware of anything, and as they go earlier and later stages में susceptible to everything. They can be susceptible to pneumonias, they can be susceptible to urinary incontinence, because immobility है तो उनको constipation हो जाता है। So then it becomes a, it doesn't remain a disease, it becomes a syndrome जिसमें बहुत सारी चीजें आती हैं और उनको बहुत वेज में अफेक्ट करती हैं। पर अगेन वो हम बार बार क्यों बोलते रहते हैं, ये स्टेजिंग क्यों की जाती है, ताकि अर्ली डिटेक्शन हो, क्योंकि जितना अर्ली हम सोच सकते हैं उतना बेटर है। आपका सेकंड क्वेश्चन था कि इसको प्रिवेंट, मैंने बोल तो दिया इतनी, मतलब लास्ट वाला तो इतना भयानक भयानक चेहरा मैंने दिखा दिया, पर उसको प्रिवेंट कैसे कर सकते हैं। See, at every point we need to be, of course, it's very important that we be in touch with our doctor, whether it's a neurologist, it's a geriatrician for irreversible causes or reversible causes, whether it's a neurosurgeon who has to be involved. So it's always a multiple team, multidisciplinary team, which is usually involved. It could be a psychologist also. It could be the person who's practicing the non-pharmacological therapy, that is art, music. So basic things have always have to be done to prevent when earlier. Make sure that the diet is good. Diet में healthy diet खाना ज़्यादा है, and unfortunately younger generation में it's not a very healthy diet that we are eating. Fatty foods, fast food is all not good for the brain at all actually. Processed foods is not good. So fruits and vegetables very important. Then exercise when they are not entirely dependent, we have to make sure that ki at least वो basic mobility हो रहा है. They have a good sleep, that is important. फिर अगर ड्रिंकिंग कुछ है तो उसको मॉडरेशन में करना है या रोक देना है, वो ज्यादा बेटर रहता है. If you discover hearing loss, correct it, because a lot of times it could be just earwax. आपने बस ENT को दिखा दिया, earwax clean हो गया और सुनाई देना ठीक. Because a person who is fighting any kind of memory issues and brain issues, having a hearing loss on top of that, the world becomes very confusing. So we have to make sure that we are able to treat all these cases. Another very important thing is to prevent, is to understand कि कौन से stage पे है. As a caregiver, understand the disease. Because कभी कभी क्या होता है, it becomes so overwhelming that care करना बहुत मुश्किल हो जाता है, and then we forget that we need to understand the disease to get them better. And one thing finally I want to say is care is available in various ways, which we might talk later about. But if you realize you can't take care of the person yourself, there is nothing wrong in it. There are specialists, there are special areas, there are special centers, there are special things which can be done at home or maybe even outside. Please seek help. Do not think you are superhuman, because nobody is. Everybody has tolerance. So try to seek help. I think that is one of the very important ways you can maybe delay it or even try to prevent it to a great extent. Of course, if the disease is progressing, please seek help where we can help you. Allow us to help you.
Thank you, Dr. Prem. That was very well explained in a very, very simple language. So now, last but not the least, Shweta, you have more than a decade of working with patients who are elderly, who need assistance, who have memory loss, or who have Alzheimer's. How in your journey of that one last decade, what has been those learning points to make life easy for the people who are suffering from memory loss and their families? So please share any advices, any experiences which you want to share.
Yeah. So, first of all, I would like to acknowledge a fact that dementia is certainly a devastating condition, not only for the person who is diagnosed with it, but also for their family members, their caregivers, and their communities. So, in my experience, I have definitely seen that, in the initial stages, when they see that their loved one, there is something wrong with their loved one, भूल रहे हैं, मंदिर जाते हैं रोज, पर एक दिन वापस आने का रास्ता भूल गए. तो ये एक कुछ बहुत कॉमन सी चीजें हैं जो जनरली फैमिलीज हमारे साथ शेयर करते हैं. जैसे मेरे पापा हैं, वो बैंक का काम बहुत अच्छे से करते हैं. डेली एक पर्टिकुलर बैंक में जाते हैं, अपना पासबुक करते हैं और दूसरे बैंक्स में जाते हैं. बट फिर वो सडन कंफ्यूजन शुरू हो गया है नंबर्स में, अपने पासवर्ड भूलने लग गए हैं. सो ये एक बहुत कॉमन सी चीज है. बट हमने ये नोटिस किया है कि फैमिलीज जनरली स्टार्टिंग में डिनाइल फेज में होती है कि नहीं, कुछ दिक्कत नहीं है, कुछ दिक्कत नहीं है, ठीक है, हम मैनेज कर लेंगे. एक आजकल की जनरेशन के लिए गूगल बाबा बहुत बड़ी चीज है. हर चीज को गूगल किया जाता है. इंस्टेड ऑफ गोइंग टू अ प्रोफेशनल, हर कोई ये सोचता है कि गूगल करके जान लेते हैं कि क्या है. आधे डॉक्टर बन जाते हैं, आधे स्पेशलिस्ट बन जाते हैं. घर में ही कुछ ना कुछ चीजें करते रहते हैं, कम्युनिटी से छुपाने लगेंगे, रिलेटिव से छुपाने लगेंगे. इससे क्या है कि उनका सोशल डिस्टेंस बहुत ज्यादा हो जाता है, अपने आप को कट ऑफ कर लेते हैं, खुद भी जाना बंद कर देते हैं. एल्डरली तो खैर उस प्रोग्रेशन में होते हैं कि वो ऑलरेडी अपने आप को डिस्कनेक्ट करने लगते हैं इन चीजों से. एंड जब पहले तो डिनाइल फेज है, उसके बाद जब कंडीशन एक्चुअली आउट ऑफ हैंड्स हो जाती है, तब आता है फैमिलीज का स्टेज ऑफ हेल्पलेसनेस. तब वो कंप्लीटली कंफ्यूज्ड है कि अब हम क्या करें। तब वो फ्रैंटिक कॉल्स करने शुरू करते हैं टू डिफरेंट प्लेसेस टू एक्चुअली अंडरस्टैंड कि अब हम फंस चुके हैं, नेक्स्ट अब हम क्या करें। देन दे आर क्लूलेस कि फिर वो साइकोलॉजिस्ट के पास भी जाएंगे, फिर वो साइकाइट्रिस्ट के पास भी जाएंगे, न्यूरोलॉजिस्ट के पास भी जाएंगे टू अंडरस्टैंड कि अब हम क्या करें, वेयर आर वी स्टैंडिंग नाउ। तब तक वो कंडीशन, वो प्रोग्रेशन काफी ज्यादा बढ़ चुका होता है, जिसमें उस स्टेज तक पहुंच जाते हैं, लाइक डॉक्टर प्रेम सेड कि वो मॉडरेट सिचुएशन जहाँ पे वो अपने स्पाउसेस के नाम, बच्चों के नाम, ये सब भूलने लगते हैं। एडवांस्ड हो गया जहाँ पे वो रिलेशंस में भी कंफ्यूज होने लगते हैं, है ना, अपनी बेटी को वाइफ समझने लगेंगे, बेटे को हस्बैंड समझने लगेंगे, सो दोस काइंड्स। सो जब ये कंफ्यूजन बढ़ने लगता है तब वो सीख करते हैं कि हेल्प, अब हम अपने हेल्प के लिए कहाँ जाएं। सो जब वो कहाँ जाए वाली सिचुएशन आती है तब आते हैं सर्विस प्रोवाइडर्स लाइक अस, असिस्टेड लिविंग होम्स, मेमोरी केयर होम्स, जहाँ पे ऑलरेडी प्रोफेशनल्स होते हैं who understand the seriousness of this condition, who understand the symptoms of each stages, and who understand how to manage these conditions. हर एक स्टेज को मैनेज करने का तरीका अलग होता है। ऑनसेट ऑफ डिमेंशिया में हम क्या कर सकते हैं, अपने ब्रेन सेल्स को हम स्टिमुलेट कर सकते हैं विद स्मॉल पजल्स, क्विक मैथ सॉल्विंग, क्वेश्चंस दे सकते हैं उनको कि ये दिस टू दिस प्लस दिस ये कितना हुआ, दिस माइनस दिस कितना हुआ, ये कुछ सिंपल कैलकुलेशन जिससे कि उनका माइंड एक्टिव रहे। कैसे स्लो कर सकते हैं हम उस ट्रांजिशन को फ्रॉम वन स्टेज टू अनदर इज वेरी इंपॉर्टेंट, जो कि हम एडवांस स्टेज में हमारे पास बहुत कम स्कोप बचता है इस चीज को करने के लिए। ओवरऑल द पॉइंट दैट आई एम ट्राइंग टू मेक हियर इज the social stigma around this subject. ये stigma इतना बड़ा है which doesn't allow the family members to come out and open and seek help. So what I actually feel is, there has to be awareness programs, more talk shows like this, wherein, we come and spread the awareness around this subject and normalize this subject. Conditions बहुत सारी होती हैं, this is one of its kind, but it can be managed well. चाहे घर पे हो, there can be environmental changes. For example, I recently had a very a discussion with a very dear friend who said कि she visited one of the elderly's houses for the assessments, कि उनका घर का environment देखने के लिए कि why elderly के लिए कैसे, how that space can be made as a senior friendly space. So there was this dementia senior, and the daughter was constantly saying, the washroom is right opposite his bed. He can actually walk down वहां पे अपना अपने आप को फ्री करने के लिए, रिलीज करने के लिए, बट ही प्रेफर्स, ही पीज ऑन हिज बेड। वो वॉशरूम नहीं जाते, बेड पर ही सारे काम कर रहे हैं और वॉशरूम ठीक सामने है, क्यों नहीं जाते हैं, क्या दिक्कत हो गई है इनको, एंड ही इज फिट एंड फाइन, ही कैन गेट अप एंड गो एंड ऑल दैट। सो द थेरेपिस्ट एक्चुअली स्टार्टेड लुकिंग अराउंड, रूम में देखने लग गई कि ऐसी क्या चीज है, व्हाई द एल्डरली इज नॉट मूविंग। देन सडनली पूरा घर देखने के बाद, रूम देखने के बाद, बेड देखने के बाद नजर गई फ्लोर पर। उनका जो फ्लोर था वो ब्लैक एंड व्हाइट टाइल्स का था, जो उन्हें कंफ्यूजन क्रिएट कर रहा था। इफ वो एक एल्डरली के अंदर मन का फियर था, इफ ही विल स्टेप डाउन, वो जो ब्लैक टाइल है, दैट इज अ वेल एंड आई कैन फॉल. So the therapist suggested, why not put a carpet here and let's see how it works. And to everyone's surprise, the elderly actually started walking to the washroom. So ये कुछ minor चीजें हैं जो एक society में एक awareness program के through live discussions हो सकते हैं. लोग, people can come out. There has to be support groups wherein people can come out and share their experiences. I also learned it through somebody else's experience. I also learned it through interacting with, say, thousands of families in a decade time. So it's more of spreading awareness. It's just we celebrate Dementia Day, but I feel that every day is a Dementia Day. हर दिन होना चाहिए. There are every day there has to be some or the other awareness programs around this subject. So yeah.
Great, Shweta. Good to learn such things from you. And I'll now go to Dr. Ghosh, who has been silent for a while now. So, Dr. Ghosh, you have done your cognitive and behavioral therapy training in Toronto, and West is quite evolved in terms of assisted livings, memory cares, and all these things. One question which I have very particularly from the viewers is, what's the difference between assisted living and a memory home? What is the difference? Is it again something which is used interchangeably, or there are specific things as pertaining to a memory care center which are not available in assisted living?
Yeah. So what happens is that when people start manifesting those kind of responsive behaviors, agitation, some aggression, and some socially inappropriate behaviors, they are transitioned to behavioral support units, where we have other trained specialists who can deal with those kind of conditions. And from there are other specialized geriatric and dementia care units where we used to manage patients with advanced dementia with aggression, physical aggression, which other units weren't able to manage. So what happens is that it's basically a multidisciplinary team where there are social workers who deals with the family members and their caregiver burden and stress, and there are psychiatrists, there are geriatricians, there are behavioral neurologists who come together and formulate a care plan. So that's an advanced setup. So if we talk about memory care centers and daycare centers, what happens is that in earlier stages, they interact with other older adults. They do recreational therapies, and what happens is that they have this sense of well-being, and that those non-pharmacological approaches actually help in slowing and delaying the progression, and that's good for their brain as well. But once they go into advanced stages, then a more like assisted living with highly specialized and trained personnel, they are needed. So
Thank you, Dr. Ghosh. And we have already crossed 1 hour and 5 minutes for this very interesting discussion. Not taking much of your time, I'll go with my last question to Dr. Prem, if he wants to add on to something on living with dementia, but few tips for the caregivers, for the family who also suffer a lot and get stuck. What should they do?
I think I think it's the most important question. The reason being, a lot of times people forget about themselves. That is, when they are the caregiver, they are so much involved कि नहीं, मुझे मेरे पापा या मेरी मम्मी या मेरे ताता दादी या जो भी रिलेटिव हैं उनका केयर करना है, जिनको अल्जाइमर्स है या उनको वेरियस टाइप्स ऑफ डिमेंशियाज है, तो वो उसमें ही लग जाता है। पर ये भूल जाते हैं कि इट्स ऑलवेज इम्पोर्टेंट कि खुद का केयर करना बहुत ज्यादा महत्वपूर्ण है। आई थिंक इट्स वेरी वेरी इंपॉर्टेंट। व्हाई? बिकॉज द मोर यू केयर फॉर योरसेल्फ, द बेटर यू केयर फॉर देम। Because there, I mean, it's not, caregiver stress is not a myth, it is a reality. It is a caregiver burden is something which for a lot of diseases people are suffering, and unfortunately a lot of them suffer in silence purely because they feel ki nahi, there is not a way things can be tackled. No, that is not the case. Already Shweta had mentioned, it's very important that you know about the disease, but try to be in touch with people who also might be caregivers. That's where support groups ki baat aati hai. In fact, in Jaslok, we were one of the first hospitals to start a support group only for older adults. But I think for dementia specific support groups are there, and there are a lot of support groups even in India as well. और important क्यों है? क्योंकि कभी कभी क्या होता है, बोलते हैं ना कि नाप तोल के चीजें करनी पड़ती है। तो वो अगर दूसरा पेशेंट आपको बताता है तो उनके एक्सपीरियंस से आप सीखते हैं, and then you are able to do the same. It might work for you, it might not work for you. However, it also makes you realize that you are not the only one who is tackling such a patient or such an issue. There are other people, and they might make you to think better. Another very important thing which I feel is कि please take care of your own health. I think health बहुत important है as a caregiver. चाहे जितना भी आपको केयर करना है, आई नो देयर आर ओनली 24 hours in a day. A lot of times you might only be the breadwinner as well. You might be the one who's to go to your work, look after the finances, and you're also the person who has to take care of the of the patient or the person with dementia. So make sure that you take out time wherein it could be your friend or it could be your family who can help out. If they are not there, there are specialists, there are caretakers, there are caregivers, there are companions. There is also in companionship, which is there for people with dementia as well. It's not that it cannot happen. And believe me, they do respond very well. For example, there is a person with dementia, one of my own patients, who loves playing card games, and she's brilliant. And the daughter asks, does she even have a problem? How is she doing all that? So that helps them because it is decreasing their caregiver burden as well to a great extent and making sure that कि उनका time बीत जाता है. Me time is very important. चाहे जितना भी हो, please give yourself time. Whether it's half an hour, 1 hour, you should keep doing you want to go to the club, meet your friends. Please do have your social life. Try to continue it in the best possible way. Yes, it is easier said than done, but please, you might be, and sometimes it happens, आप बहुत अच्छे से प्लान करते हो उनका केयर, पर उस प्लानिंग में आप अपना टाइम नहीं डालते हो. तो just include that time, take care of yourself because that is very important. Very, very important. She's already mentioned Google. Please ask reliable sources. Ask your geriatrician, ask your physician, ask your neurologist, ask your neurosurgeon, or ask your doctor. Do not do things on your own or do not have misconceptions. Clarify things. At every point, you can clarify. Every doctor usually just answer to your questions और अच्छे से आंसर करेंगे. अगर खुद नहीं कर पाएंगे तो आपको गाइड जरूर करेंगे. इतना याद रखिए. And very important is team hai. As Dr. Ghosh mentioned, it's a teamwork to take care for people with dementia, people with Alzheimer's. So seek that help. You are always a part of the team, but you should not be guilty कि नहीं मेरे से इतना ही हो रहा है, मैं और नहीं कर पा रहा या कर पा रही. Seek that help. We always do that. अगर कुछ प्रॉब्लम होता है हमें, चाहे ऑफिस में कुछ कहीं प्रॉब्लम होता है, तो we take it to our superior or we take it to our friend, whoever, or your compatriot, and we look for solutions. So don't take the entire burden on yourself. Make sure कि आप अपने आप को de-stress कर रहे हैं. Have your hobbies. Make, whether it's music, whether it's just closing our eyes for half an hour and not thinking about anything else, but just being in peace. So try to be at peace because it's very important that your mind is still and your mind is calm so that you can take care. And finally, it's okay to be overwhelmed. It is not a very easy disease to tackle. You can get overwhelmed. It's fine. But when you seek help, we will help you to go through that. So we are there with you to take you through that journey. But ultimately, what you want is you want a very good care for your person who is suffering from dementia, and you want a very good quality of life to whatever state they are, and whatever is their last day in this particular earth. So I think that is the most important thing. The goals are very common, but seek help because there is help and there is care at every level. Ghar pe ho, assisted living ho, daycare center ho, particularly memory center ho. And finally, do not get scared about the memory part. It might be the most highlighted, but it's not the only one reason why a person can present. I had a patient who just could not recognize herself seeing in the mirror, and that was a red flag because the person was koi aur hai wahan. And just to add to it, that's why I won't say dementia patients suffered a lot during the pandemic because it was not easy to give them therapies online. Why? Because there was an image there. Certain people could do it, but certain people could not because there were three images. One, there was people talking from there, then the person could see their own image when they're talking. So then there was a lot of confusion for certain people as well. And finally, there is also technology. So try to utilize that technology. You will be able to know what's happening with them. Don't always keep thinking. And one important thing is, आपको अगर आप workplace में है, so trust the person you have entrusted that care. If you are still going to be keep thinking about कि care क्या हो रहा है, then it obviously becomes difficult. And transitioning to an assisted living is very important. a lot of times it becomes difficult ki, as a caregiver, ki, what am I doing? How can I keep my own parents somewhere else? It's my job, my duty to actually take care. And a lot of times society can say, Arey, kya kar raha hai? I mean, you know, but be headstrong in what you're doing, because most of the time you'll be doing the right thing. Please don't be guilty. You can only do whatever you can, but seek help. I'm repeating that again and again because there is help. Seek help and try to destigmatize this disease, because the more you talk about your journey, also about your person, you never know how you're helping out people. So please try to share those stories as well, because you are the true heroes as far as caring is concerned.
Thank you, Dr. Prem. I think you have wrapped it up very, very nicely. Right. I think you've covered all the aspects. Thank you, team. It is late in the night today. I know you all are very busy people looking forward to go and see your families. Thank you so much for your time. And thank you for very interesting and enlightening session. Thank you so much.
Thank you,
Thank
Dr.
you,
Gaurav.
Gaurav.
Thank you, everyone.